Good afternoon, everyone. Welcome for another update on the Brooklyn Family Support Service Advisory Council. I'm Christopher T. Wright with Brooke Wright next to me.
Hi, everybody.
She will be joining me later on. Let's get on to our regular business today. As you know, we have a lot of things going on today, and I mean a lot. So I'm going to say this very quickly, and because our speakers are here, we have Ruth from Include NYC and Reggie Barron from the MTA Reduced MetroCard. Deborah will be giving you guys updates also early, as well as I will give you more of my updates later on. But before we do introduce Ruth, just remind everyone, as the governor has said earlier today, everyone must wear a mask. It is very important to wear a mask. Please keep yourself together. And as I said before, please make your own mask. The schools, when you get your meals from the schools, you can pick up masks at there as well. Or make your own mask, as Deborah and I have mentioned this 100 times.
Mm-hmm.
Now, our first person is, because since everyone has been very concerned about the schools closure and a lot of things that have coming up, it will be really good to give her an update and everything. And I know my volume is up to max. It is important to get everyone attention on and pay close attention. So Ruth is here, the young and beautiful Ruth, and I can say it because she'll kill me later. I don't care. Ruth is going to give you guys some idea tips, and there's something coming up tomorrow. Ruth, you there?
I'm here.
But you're very low.
Is this better?
Yeah, when you
Much better.
when you thumbs up now.
Okay, terrific. Okay. Hi, and good afternoon. It's cloudy out there, so it looks like I have a little bit of rain. My name is Ruth Carolla. I'm one of the senior family educators at Include NYC. And Include is a nonprofit organization which is actually a parent center for New York City. The title for parent centers is Family and Community Centers. And we are available to help parents navigate the special education system to make sure that their students get the right services, put into the right classes, to understand their IEPs, and all of the details that go into making sure your child gets services so they can make as much progress as possible. Tomorrow night has two events. The first event at 5 p.m. And you can register for this on our website, which is nyc.org. Is talking about graduation and the procedures to make sure that who are due to graduate are able to within a lot of time.
Excuse me, Ruth, I'm sorry to interrupt you, but there people are asking, can you please raise your voice a little bit?
Sure.
Because they can't hear that conference, what you're saying.
Okay, so tomorrow night, we have two events going on. The first event is going to be a webinar with the Department of Education, Lauren Boland, who supervises parts of the special education system, and she will be speaking about graduation requirements in this new reality. So it's at 5 o'clock, and if you would like to join the webinar, which I think is going to be really well done. Lauren is, and it's being hosted by Include NYC. Just go to our website, and you will be able to register at www.includenyc.org. When you come onto our homepage, there so that you will be able to register. That's at 5 o'clock. That will go from 5:40 until 5:45. At 6 o'clock, there will be a parent support group. And we've been running this parent support group for several years. All these years it's been done in person at our office on Tuesday evenings. But now with this new reality, once again, we're doing it remotely. And we have parents who join in from home. And we talk about, the challenges of homeschooling, of working with your children, balancing your day, and parents' own concerns and frustrations and feelings they are having. This is at 6 p.m. And once again, it's a Zoom meeting. Register again at our www.includenyc.org. And we've been doing this for a while, and actually, because it's being done remotely, more parents from further distances are joining in, which is really kind of wonderful. So I hope anybody who's interested would come on in, join us, and ask questions and discuss their feelings. And one of the most important and beautiful things about the support group is the fact that parents share what they have done to make this time period more productive and more at ease. So I hope you will be with us. So again, there's students from 0 to 26 receiving special education services and navigating the system. There's several family educators that are available to take one-to-one phone calls about any of these questions. Call our helpline at 1-677-4660, and someone will answer and help you schedule an appointment to talk to a family educators. The appointment will be at a specific time on a specific date. In other words, if they say Ruth will call you at 10 a.m. on Tuesday, at 10 a.m. on Tuesday, your phone's going to ring because they control my calendar. So the more the number 1-677-4660, and there is a Spanish helpline at 212-77-4668. Call us and have your parents give us a call. They are running up against something in the special education system that they would like to discuss with the family. So, does anyone have any questions at this time?
Yeah, there's a question coming from, now my email as well, which some people, and forgive me if the background noise is, there's ambulances got to go through in an emergency anywhere. But the question is going to be, Ruth, a lot of the families now are concerned about the IEP, because this is mentioned earlier as well, as I've been getting these questions for the last 20, at least 80, 96 hours already. IEP, the procedure of IEP is, since our mayor has not been following really not looking at the IEP, what can families do at this time with the IEP since school is now out? And some individuals, and I'm going to say some of our students who have disability don't really like going to summer school, because some of them want to go to camp, or if there is a camp, or.
Okay, two different.
And can you speak up a little?
That's two different issues. In terms of the IEP, IEPs are still being done on a regular basis. They are being done remotely. There are still IEP meetings. They are still calling or letting parents know when those IEP meetings are going to take place. They will have the regular team of people, the psychologist, the social worker, the gen ed teacher, the special ed teacher, and any providers that are necessary. You can bring everybody into the Zoom meeting or the Google Classroom meeting. It is still going to take place. The IEP meetings are still moving forward. Parents are still, talking about what they would like to see for their child, what kinds of services. And because this IEP goes forward, you should treat this IEP as a real IEP meeting for next year when hopefully schools will reopen. So this is not something to be ignored or feel that it's really not worth it because we're not in school. As far as this IEP goes now, it's a real IEP meeting, just on a different platform, the same thing that you would have as to have before the end of the year. In addition, if you have gotten or your parents have gotten remotely, they have kind of modified the IEP itself to not go by the remote learning plan, go by what is written on the real IEP, because that's what you're working on. Okay? And in terms of summer school, we just don't know yet. Don't know about 12-month programs, separate issue from the IEP. Don't know about it, but as soon as we know, believe me, it's one of the big questions, not only for our parents, but for our staff. Many of our staff have children who normally go through 12-month programs. They are telling us there will be some sort of summer school, and we suspect it's going to be done remotely.
Those were the main questions that people had, because as you know that there is one question a lot of people are a little pissed with now, the new chancellor, because he's saying school for the fall is 50-50. The only thing I think a lot of families need to be prepared for is, as Ruth, you just said, and I'm going to say, and as the governor said, we don't know yet. And I suggest people should go to that meeting, listen. But if you have additional questions for Include NYC, as Ruth gave you the phone number, which is always available, very good. Ruth is always excellent. That's why I really call her Professor Ruth. And she can relate it, but guess what? It is true. Ruth's been giving us a lot of great information, and that's the reason why. That's why even your fan club will say, "We love you, Professor Ruth." And yeah, and right now, Ruth, but I really appreciate, because I know you've been really ultra busy. And as Ruth, I will vouch with her, because 3 parents have called, not just for Ruth, but someone in their department, and they have gotten help. They do want to say thank you, but there's a lot of people want to know, how are you feeling? I had 3 parents ask me that this morning.
Yeah, fan club, we all want to know, how are you doing? Because this is even though this is a stressful time for all of us.
Mm-hmm. And
I'm fine. I'm doing well. Thank you.
How's your bird?
My bird is fine. Sleeping because it's cloudy out.
Yeah.
Yeah, you're right, it is.
Ruth, question for you. This came from Tina Vale from the Bronx. And I know you already said it earlier. If new information does come out, and I think Debbie will agree with me as well, if any new information you find out, you have any tips on that?
It immediately goes onto our website. We constantly update it. There was an email this morning.
Yes, I know.
Still updating it, so you can always trust that information, because we get it directly from the Department of Ed on the inside, so we don't have to wait, to have things go through the news. So we get information as soon as possible. Always trust what's on there. It's always fun.
Mm-hmm. Well, Ruth, I know you have a busy schedule, and I can tell you this also, as I'm telling someone right now, if you have, just let everyone know, Ruth in Ruth Agency, which unfortunately I'm saying including NYC, is available on our website as well because they're linked. So anything Ruth updates, it's already automatically on our website already. And they have trainings every day, which it's not easy to put them every day on the website because, as I told people, you can't update the website every day. It has to be once a week to keep the flow. Because
we have a calendar. If you go on our website,
yeah,
at the top of the website, there's a blue bar.
Mm-hmm.
And the second tab on that blue bar says calendar. If you go on, you click on there, our calendar comes down, and you can see what's going on that day around the whole city.
Yeah, and I can tell you that
It's a very good resource.
Mm-hmm.
And as from one parent to another, I say thank you because it's very important. I mean, between me and myself in Brooklyn, that he's better grammar, and Tina, who's in the Bronx, my counterpart, we try to help as many families as possible. And you know something? I'm getting to the point where I'm enjoying doing the meetings through video.
I know, I thought I wouldn't, but
I'm enjoying it because I can stay home.
Well, it's not just home, but it's also helping.
We can get bigger numbers, and I also appreciate that because I need to, I've been this way. I get the information. We can reach more families or professionals who could help the families. I think it's great. I'm not happy about, of course, I don't wish anybody that I didn't want the COVID-19 virus, but I am enjoying that fact that we have this technology. I hope we can help more families get this technology so that when they can get the help with their children to try to teach them at home, which I wish everybody good luck.
I know, Ruth, you have to run, but if you want to stay on, you can join us. We have our next speaker is Reggie Barron. That's giving us an update with the reduced fare. If you want to stay on.
Thank you.
Yeah, let me see. Reggie, are you there?
Good afternoon, all. This is Reggie Barron with MTA New York City Transit Mobile Sales. We are the outreach team for the reduced fare program. At the present, we're still canceled our services until the notice. We will more likely get an update closer to the May 15th date. The announcement that I would like to make is the MTA Essentials service during the coronavirus pandemic. Beginning Wednesday, May 6th at 1 a.m., there will be no subway service from 1 a.m. to 5 a.m. while the MTA disinfects trains and subways stations. They're operating essential service during the COVID-19 pandemic, so that healthcare workers, first responders, and other essential personnel need to are transported to where they need to go. Much of the service is running can be with crews who are healthy and available to work. The service on many lines may be limited. Governor Cuomo is requiring everyone in New York to wear masks or face covering when they're out in public. Please, if you're not traveling for work related to essential businesses or urgent personal business, a medical appointment, do not use the subway or take the bus. We need to keep our limited capacity available for people who must travel. Again, I will provide an update on the reduced fare services as we get closer to May 15th concerning our outreach services. But we are available via my email or the customer service. If you dial 11 if you have any questions concerning reduced fare, I can assist from remote. Chris, that's my update.
I have a question.
Before, Reg, you mentioned doctor's appointments or people are going food shopping. It is important, and I apologize for the inconvenience a little bit because there's a. But the main thing to remind everyone: if you're a walker, cane, motorized wheelchair, or any mobile devices, you're still allowed to use the front of the bus. But I will remind you that you must be closer to the pole so the driver sees you. If the driver does not, TA, as well as the ACT members, who are, even they have to go out or not, they may be doing the same first responding work as well. They will, make sure that everything, as well as every division, every depot must follow these rules. Because if they don't, it's going to be a problem. But I agree with Reggie saying earlier about 1 a.m. to 5 a.m. This is only the subways, not the buses, not the Long Island Railroad, and it's definitely not the Metro North, and not Accessoride. It's just the subways. Am I correct, Reggie?
You are correct.
Mm-hmm. Now, before we go into questions, Deborah Bright Chair in Brooklyn has a question for you.
Okay.
Yes.
Well, I didn't have a problem paying for reloading my Metro card at the train station. But one thing I saw was, is it true? I saw the sign saying because of the COVID-19 that any of the bathrooms are not being allowed to be used by the public. Is that true?
Yes.
I will have to research that for you, but at the present, I don't have the answer to that question right now.
Okay.
Yeah, I would have to check with the stations department.
Well, if you do, let me know, please, because when I took one look, I went, that's not good. Because a person starts getting sick, they need the bathroom immediately. And they have to
check.
I appreciate that.
Updated policy, okay?
Okay, there's one more thing I want to add on. Most of the times when you do board the bus in the front, when you're trying to board the bus in the front, the driver will, most of the time, the ones who will not let you in when they should, is they keep the door closed and keep going, no, go to the back, you have a walker or a cane. The only time I agree with that is because there are 2 wheelchairs on already. And the way they have the crisscross with the tape and stuff, which I think is not great, that means I can't get on, and I'm not happy about it. I'm not angry at the wheelchairs, but I can't get on because I can't go sit in a single seat, which is actually really the walker's seat. When we get on the single seats, so, and for me and the cane, people who use canes, and I really just sit. I mean, I know, I'm not saying you have done this, not you, Reggie, but we have to let the MTA know. They have to understand that when we need to get on the bus, I'm not going to try to lift the walker. Oh,
He just gave me the answer to the question.
Very serious. We have to. I mean, the driver, I said, you may think I'm strong. I said, and maybe I am. But when you lift the walker, I will re-break my foot again. So we have to educate them. It seems, I mean, maybe there's a way also, we can all safely have them major training for them to understand that people can have disabilities that are so well hidden you wouldn't know what it is.
Well,
Okay.
yeah, and I think Reggie and I can well say, but there is a question to the answer. Because this answer was mentioned earlier, and I can vouch with Reggie. Stations did close the bathrooms because stations because of the homeless pandemic, they don't want.
Correct.
They've been hiding, according to what we've been hearing, and this was
Okay.
not just Kings Highway in Brooklyn, but they've been hiding in the bathrooms, and some of them may be contaminated. They have to be washed, but never. Or cleaners are now being rerouted to soon. I don't know if they're going to be the train yards or the station, which they're going to be starting working at night because it's not easy for them to clean stuff right now because they have to make sure turnstiles. And the more people don't sneak into the bathrooms thinking it's their own personal apartments, and we need to remind our NYPD on this too. But just to add one thing for Reggie as well, and I think you should hear this. I just got this from Long Island Railroad. Murphy Hill customers on your station renovation is now completed. ADA accessible now. Is the Murphy Hill station is now completed. Murphy Hill's Long Island Railroad, as I just said. And I want to thank the Long Island Railroad just gave me this information. It has 2 elevators, lights, I don't know what the other.
Let me see.
Signages, station cameras,
Where's my
retaining
retaining
walls, and pigeon. There's special ones they don't make sure.
pigeon attachment, which I appreciate.
Yeah, he seen and I want to thank Long Island Railroad. Unless they want me to mention their name, you can just send me right back at me. But thank you very much, Reggie. The question there's a question for you also.
Yes.
And I just want to let you know, Tina Bell does not have a question, so she says hello. She's listening right now. Question is what is the procedure right now? And I think you already know this answer. If a MetroCard does get damaged because of the trains,
buses.
No, buses are free now.
So
let's get to the question, please. The question is still going to ask, if the MetroCard is damaged, what is the procedure now?
To mail it in to first obtain an envelope from the station booth, because if they're in the station, and to mail it in, especially for the time-based card, the unlimited, because they'll get the credit on based on the post date of the envelope. So it's imperative that if it's damaged and you have unlimited time, like weekly, monthly, that you put it right away. Okay?
Okay.
So at present, mailing it in and getting the cards to customer service.
Reggie, because the last question you cut off a little bit. Recharge the MetroCard. And you know that some people with disabilities or seniors have trouble using the machines. What is the procedure now? That means they're telling people just use the machine with no one around to help?
They're attempting not to have person-to-person contact.
Yeah.
But if there is a person in the station booth, they may be able to give them assistance at the machine, but they're trying not to do any transactions at the subway booth. But they will provide assistance to people with disabilities if necessary. It's really they're there, the agents, but I hear there are very little transactions happening at the subway booth.
Correct.
Yes.
Yeah, and I actually agree with Reggie, because, as you know, they don't want, they don't know where the money came from. It's because of the corona, and you want to keep those booth people staying where they are. But they are helping. I will say they did help. These a couple of stations. They did help certain people with disabilities. I thank them very much. But as you know, right now, they don't. This is ordered by the governor. They don't want them to touch the money, because you don't know where that money came from, because of the germs. But that might be some changing. We might be going back to normal. Hopefully, if everyone please follow procedures. Reggie, I have no more other questions. Do you have something to add?
No, not at this point. As you said, but as we get closer to May 15th, maybe sometime midweek next week, I would have an update on the Regis Fair, and I will relay it to you.
Okay, or I might say, Reggie, you might come back on next week and say, it's Reggie time again.
Thank you.
Yeah, but I do want to remind, as you know, Reggie has been very big supporting, not just in Brooklyn, but the other boroughs as well. And let me say this clearly to everyone, because I did get a lot of thank yous too from you, Reggie. For example, some people saying, there's one question somebody asked me, and I had to say, I'm not saying the name, but they asked me, how are you feeling, Reggie?
I'm feeling well, thank you.
Mm-hmm. And just letting one know, Reggie has been working wherever he is. You can always put the big sign saying RB, Reggie Barron.
I'm glad to be of service.
Yes. And he's too young, and let me tell you, he's still young.
What you've been doing, Reggie, because honestly, it's very good, and we need your help, and I appreciate that you help us get the cards that we need, half their cards we need.
Especially, if you go somewhere else, you don't get this help in other states, because you have to go to their main office, which it's not really right to the people. They need to copy what we do in New York. I might be wrong, but I'm just guessing right now with New York. I only see New York with these vehicles going around the borough, especially Nassau and upstate Westchester. Am I correct?
That's correct. We go to Westchester every third week of the month. As high
When you
as
can.
Yeah, when you
When
can.
they allow it.
Yes. Hopefully we get back to service,
How-
resume service.
There is one question that just brought up. How far do you go up when you're in that?
Yeah, how far north do you go when you're out of New York City?
Highest Peekskill, the Peekskill Senior Center. We park in front of Peekskill Senior Center.
Oh,
Peak Skills. That means that's before the Bear Mountain Bridge?
yes. Do you see the Bear Mountain Bridge?
I believe so.
Yeah, I thought so because we have to go to Albany. We pass Peekskill.
Yeah. So you mean
That's far.
so those should be what, those buses still run with our metro cars all the way up to Peekskill? Wow.
The Beeline.
Yeah.
It's available at the Beeline, yes.
Wow. That means I can say, oh good, I can take the bus with my metro card.
Yeah, Chris, you can go take a bus ride. Enjoy.
Yeah, well that's actually pretty good. That means you're using it. But Reg, I know you have a busy schedule as well. I thank you so much, and I will, if Reggie has more up-to-date stuff, you'll see him again soon. So thank you again, Reggie.
Thank you all and be safe.
I will.
Thank you.
If,
You too.
if you got to stay on, just stay on. Otherwise,
I'll be on.
Okay. So if you have any questions, just say Reggie has a question.
Okay. Is it my turn
Yeah.
finally?
Now it's Miss Greif's turn, which she's going to give you guys an OPWDD update. Miss Greif, how are you?
I'm doing well as can be. I just want you to know that the chair of the statewide advisory is Mrs. Margaret Puddington. I chair Brooklyn. I am the Brooklyn member that goes up to Albany. My Bronx counterpart happens to be Tina Vale, who also goes up to statewide with me. Now, Margaret sent this to us. As of 4/23, there were 1926 COVID positive cases. These are in our population. And sad to say, 276 COVID positive deaths among people served by OPWDD. A mortality rate of 14.3%. Sorry, it's very tiny. How we try to raise it, doesn't. Among the deaths, 90% were from downstate. 85 were individuals from age 50 plus. 63% was men. 30% women. There seems to be, but also there are more men in the system than women. And the primary comorbidities associated with the deaths include hypertension, diabetes, and heart disease. OPWDD is only tallying positive cases, not presumed or suspected cases, because there's no objective standard for presumed cases. Participants on the call requested data by affected regions, trends, and setting. As of April 29th, there were 2,139 COVID positive cases and 319 COVID positive deaths. More people were tested than previous. There's no breakdown for the data provided, but we were told the breakdown was similar to that given on the 23rd of April. Participants on the call reiterated requests for additional breakdowns, especially by region, in order to identify any burgeoning clusters. Now, hardship pay. LPWD is working to ensure that New York State is including hardship pay for frontline workers in its request for federal funding. State workers are getting a raise, but it will be deferred until July. Our director for New York City, Aviva Kindo, is connected with all but 4 FIs, and they understand they're expected to provide protective PPEs to the staff. They have to give them protective equipment. They are the employer of record, and it's their obligation. Some FIs are also providing PPEs to individuals supported. Others are informing individuals where to obtain them. Individuals may use their OTPS to pay for the PPEs. Guidance or retainers pay for staff is still under review. Once released, a webinar will be offered. Self-direction budgets are still being processed by the DDROs. Programmatic responses in certified settings. Commissioner Kasner reviewed OPW accomplishments dating from the onset of the COVID crisis, including guidance, development of temporary residential settings for COVID positive individuals, data collection, and new OPW website, now looking to prevent a second wave. The commissioner pointed out to the difficulty of testing in residents. OPWDD does not have that capacity. He stated that hand washing, environmental hygiene, cohorting, and self-screening are very effective. Quarantines can be implemented immediately, but there's a lag in getting test results. Now for fiscal, no new information or enhanced IRA rates or retainer pay. Payments not yet approved. A participant pointed out that the delay in payment is causing serious cash flow problems for providers. OPWDD and DOH were urged to expedite the approvals. Hospital visitations. If a hospital refuses to allow a companion to be accompanied someone with IDD during a hospitalization, contrary to the Department of Health policy, OPWDD will help. Aviva Kindo has gotten Department of Health to intervene. If you need help, please take this. You can contact your regional DDRO during regular office hours, or if this is after, call this number, 855-696-7933. Say it one more time, 855-696-7933 after hours. Remember, we did put on our website as well as the OPW website. There is a letter that the New York State Department of Health has put out that explains why individuals with developmental disabilities must be accompanied by a companion. At the moment, we only have it in English and in Spanish. If their family doesn't speak that language, make sure if you can get it translated to their language the parent can understand, but always keep a copy in English so that the hospital staff will see it. Now, the other thing, reopening of OPWDD service. OPW is beginning to think about plan for reopening of services while continuing to protect health and safety. At the moment, we don't know anything more. There's a possibility, as we heard before, the governor said the state may open on May 15th. This Thursday, I will be participating in the statewide advisory council, and I'll be doing it by video conference / with the phone. I know that the families, you want to know when are for your families with children are in adult day have services. We will find out when they're going to restart again. For families who get in-home rehab or ComHab respite services, we'll let you know when these are going to happen. We don't know. I wish I knew. I don't feel right now I can't give you the correct answer, but I'd rather not say something that I am not sure of. It is extremely important that we do whatever we can to keep our individuals healthy. Plus, the important thing also is we have to keep the staff healthy because we need them. So we will keep everybody informed as soon as we can. So with that, I appreciate that everyone, I know that we're all working together to help. We would appreciate if you have any questions, concerns, please let us know. Remind your elected officials that our OPWD frontline workers need to get the correct pay. We also need to make sure that they help them get the correct protective medical equipment, masks, whatever, and that includes whether they live at home or in a residential setting. So I know that the mayor has been saying get it out, but so far nothing has been done for Southern Brooklyn. So Councilman Mark Traeger, Congressman Max Rose, State Senator Diane Savino, State Senator Andrew Benares are fighting very hard to make sure we get these masks and other medical equipment needed in this part of Brooklyn. if I'd appreciate everyone. Facebook, complain to the mayor because this is not fair. But with that, if anybody has any other questions,
just email us.
just email us and we will try to answer the best we can.
Now, let's get back to our other update businesses.
Yes.
Because we do have some more information. We have good news to put up. Tomorrow, oh, no, I shouldn't say tomorrow, but should I say on May 13th is the CARE coordination meeting, which will be Rose's meeting. Will still be scheduled to meet, but it will also be on the Ring Central. You can get that information on our website as well as on the email. So please make sure you get it. It will be on May 13th. We ask everyone to please get on by 9:50 so everyone knows how to use the Ring Central. We will have some speakers, some guests, giving you guys an update, but we also want to hear from the CTOs, the parents, anything they want to say on that meeting date, which is May 13th. So please make sure you write that down. Our Brooklyn Advisory Council meeting is still on the schedule, and normally it's still in the normal schedule. Once again, we'll be back on the video, which is May 19th from 9:45 a.m. to 12 noon. We remind everyone to please get on at 9:45 to make sure they're on the video so we can start the meeting on schedule, because our agenda might get bigger and bigger by the time, and by that, if everyone does good by then, we should be just fine. And as a reminder, everyone, the password is this year, 2020. It will get you on by video or by phone. So please make sure that you join us on those two meetings. Regarding the Brooklyn DD Council meeting is to be announced. Once I have that information, I will let everyone know. Also, just to remind everyone, our website is updated with a lot of new features, how to keep your family busy. As Reggie mentioned earlier about the MTA, about the reduced fare and the cleaning procedure, we ask you guys to please follow that. And please let the trains, please don't try to travel between the hours of 1 a.m. to 5 a.m., which I think 90% of us don't, but it is safe. If you know someone's working that time at night, please make sure they get home by a certain time, but don't have to worry because the buses will be running, as high vehicles will be available for those first responder workers. So please make sure you set up a routine. And I remind everyone, 1 a.m. to 5 a.m. Now, I remind everyone, face masks again, and as Reggie has said it also, and as well as Ruth. Reggie, you still with me?
Still with you.
Okay.
Yay.
As Reggie and I both will say this, as well as Debbie,
That's true.
it is important that everyone must still wear their mask. Please, guys, the mask is important. So from now to May 15th, as you heard the governor says, if you want everything to go back to regular business, we need everyone to, number one, stay healthy. Number two, wear the mask when you're going into stores or mass transit or anywhere you're going to see a lot of people, because there's certain areas you can't just tell them to spread out. That's like human impossible on trains and buses, but that's why there are masks for a reason. But please make sure, so as business will be opening slowly and carefully, we need the encouragement from everyone. So please, everyone, let's stay calm and relaxed. If the weather is nice outside, yes, wear the mask. As the governor says, you can put the mask like right here. If no one's around you, say like it's me and her, we can just do it right from here because we're mother and son. But when the child is this little, that's really hard to explain how to put a mask on.
That.
Yeah, come on. You know what I'm talking about, little, because people have to see the screen.
Yeah.
So please, everyone, and very important also, please make sure you take hand sanitizer. Don't use it like it's like liquid gold. Use it wisely. But when you're getting to once you get home, wash your hands, change your clothes, make sure the clothes are in the bag, air down. If you're in a private home, you can just do your laundry ASAP. But make sure you air it out, your clothes, and make sure everything else is done. And I know a lot of people have a lot of concerns. I encourage you, everyone, to please visit our website, which is www.bfssac.com. Special Olympics is giving out some great tips also about workouts. Keep your individuals, a little loose, get a little, stretching. Also, if you guys have the Wii game, try to do some Wii a little bit. Do a bowling challenge. Do some other activities to keep them busy. And you know what? Art, because there's a lot of things going on with art out there. And I know that I just got something on Facebook, and I just sent it out just a minute ago. They're doing an art event that's coming up tomorrow. Well, it's supposed to raise your voice for arts in New York City public schools, and that's actually going on this Wednesday at 7 p.m. That's also on the Facebook, but it's not included, so I don't know what organization it is, but you can always find out if you're interested in, it says it's hosted by Rachel, WATTS. No, it is part of the school division, but it is asking everyone to join the art campaign. I don't know why they're saying like dinner costs and whatever, but I don't know how people are going to travel. But the main thing is it's something to look at as well, and as well as Google anything interesting art, and maybe even do a makeup mask for yourself. Wear it comfortably, wear it calmly, to be more safely. One other thing I'm going to add is because when we met the Mayor's Office of Disability this past Friday, they did give some little bit of information, resource information, Department of Consumer Affairs. They are, they're, doing a lot of things. They did remind people for asthmatics. If you're a person that is an asthmatic, you are allowed to keep the mask down a little bit. Try to keep your lungs, your nose a little clear, but always be very careful for no one else near you. Especially if people are not supposed to be smoking, you really got to be careful. As the weather's getting warmer out there, we have to be very cautious and be very careful. The Consumer Affairs is available. If anyone has any questions, you can visit the Mayor's Office at Moped. You can just Google Mayor's Office with Disability and just click on the resource. Jonathan Nowak was here last time, and he gave a lot of information. I know a lot of our families got a lot of good information. So let's make sure that you all get it. As Reggie already mentioned about the as of Wednesday, but we have one good news. The C train has returned. So the C train will be running to make it easy for the A line. So you have the A and the C. But there's still no B, no W, and the mysterious Z train is not running. And the 42nd Street shuttle will not be running. Now, remind everyone, since the B is not running until further notice, you can use the C, the D, and the Q service instead. The W, the W is not running, but you can use the N or the R, your choice. The 42nd Street shuttle, they're asking you to use the 7 train. Now, since Grand Central elevator is not working going towards the 7, you can still go upstairs and take the M42 bus to where you have to go, your destination. But I really think you need to be careful when you travel. A lot of the other trains are still the same. The 5 still going to Bowling Green. When the A's run rush hour to Rock Park, that's not running. The E trains, then during rush hour, they do go to 179, which they're suspended. They will just go to Jamaica. Just make sure everyone check all the updates from the MTA at all times. And when Reggie does have an update on the reduced fare, he will let us know. Am I correct, Reggie?
That's correct.
Anything you want to add?
No, just want everybody to be safe and healthy, okay?
Yeah. And
Thank you.
And Reggie, this is also for you too as well. Mayor's Office of Disability is doing a survey. So we're asking everyone, it is available on our website. If you go to the emergency preparedness page, click on the Mayor's Office of Disability. This email was sent out. If you didn't get it, please let us know. Just email us, and then I'll forward it right back at everyone. The survey is just to keep everyone up to date and help out. And that is all I have. So does anyone have any additional questions? Please put your emails in. I'll wait a few minutes. I know a question, and I hope Tina Vale has a question as well. I know she's somewhere, or anyone from the councils, other boroughs, or maybe joining us. I don't know if they are. But it is important to everyone to please keep up watching the governor's press conference. As you know, the governor has mentioned, the mayor has mentioned about face masking, like constantly. He's already saying 2.5 million being closed back with. He's talking a lot of things. So, and since no one else has additional questions, and everyone knows how to find me, and Reggie knows how to find me, and I see kids already taking advice, put on the Halloween costume mask on. That's something smart.
Mm-hmm.
So, anyone has any questions? Do you?
Yep, I'm fine.
Reggie, do you have anything? Reggie? Hello, Reggie, you there?
I think
Hey, Chris. Yes, I hear you, Chris.
Okay, no, I was just asking, do you have any other additional questions? Because I'm just
No, Chris. I'm all set. I'm gonna have to pick up another call, okay?
Okay,
okay,
Renee.
bye, Reggie. Thank
Have a good
you.
night.
And that's
Bye.
Reggie. And I will say this. That's Reggie
That
Barron.
was Reggie Barron. This is Deborah Bright.
And I'm
then
Chris
Crystal
Gry, saying thank you for
Yeah.
pleasing, thank you for joining us on this update. We want to thank Ruth and Reggie,
Yeah.
both our guests as our special guests.
Yeah.
And we will keep you all informed as soon as anything comes up. But we will see everyone next week on our sign up update. Have a great day, everyone.